Hello GMCVO panel, my name is Andy Higgins. I'm the Deaf Community Officer here for Salford Deaf Gathering. First of all, let's start with some access. Great. So I'm going to talk to you a bit about Salford and some information of why we're applying for funding and some context. Well, first of all, I want to talk about terminology. I'm going to use the deaf community term, and for that I understand this as being deaf people, and I may refer to them specifically. So deaf with a big D relates to those people who are usually born deaf or have become deaf early in life, and they are British Sign Language users. So they communicate predominantly through sign language. The next one is smaller d with deaf people, which normally rely on lip reading. They're generally classed as being in the hearing world and will associate with other hearing people. They may use hearing aids such as behind the ear, cochlear implants, Bahas, or the new Osseous implants. And then we'll also connect to things like hearing loop systems that are induction loops, and then also may use Bluetooth as well. So they're using technology as well as lip reading and sound to communicate, so deaf people. But it's also that these two groups don't generally mix because of their specific access needs. And I think what's key is we're going to talk a lot about one size doesn't fit all. So deafness definitely has that big mix, but there are lots of common threads that come together. One thing at Salford's deaf community we very much use is something like this model here, which is the equality, equity, justice and inclusion model. So equity, equality means everyone gets the same thing. We'll give everyone a box, they can all see over the fence. But actually that's not true, because one size doesn't fit all. The equity model is we're giving you two boxes, you can see you need one, you don't need anything. So okay, you can all see over the fence. But actually a justice model is let's look at it, what are the barriers and how do we remove the barriers rather than kind of create something later on to help you do it. And a true inclusion model is what is a new buzzword, is about collaboration and true co-production where deaf people's voices are involved to inform and shape services. Some information for Salford. Salford in the Office of National Statistics 2021 census said 0.03 of Salford's population are British Sign Language users. Of some of that, I think some of those are also people who are hearing that have ticked BSL. So there's about 850 BSL users in our city. Where this becomes interesting is the RNID, the Royal National Institute for the Deaf, estimates that 1 in 6 of the population of the UK has some level of deafness. However, 60,000 people in Salford have been issued with a hearing aid under the NHS from our central audiology as part of the Northern Care Alliance. So that doesn't include authorised qualified professionals, places like Specsavers, or those people who have bought private hearing aids. So putting all that together, while that would equate to 22.5%, with those that we don't know about, you're looking at more like 25% of the city, which is 1 in 4 of the population. Salford's deaf community has 4 main aims: is to raise awareness of the needs of deaf people in the city of Salford, to work with partners to improve the availability of information in a format that is accessible, and to work with partners to shape service provisions into a quality service that truly meets the needs of deaf people and who can use accessible services in the city. I think it's really important at that point to say that as we are now moving into an integrated care model, we very much have been influencing at a greater Manchester level things like sexual health. We spoke to commissioners in the last year. We've also made representations, spoke to NHS Greater Manchester to look at improving their comm services. And while they say we've been given information to then send out, and saying you're part of the problem, we need you to then challenge that this information is not inclusive, but it's not accessible to parts of our community, and we challenged them and dared them to do better. We also provide a gathering space for deaf people to come together regardless of their gender, sexual orientation, political or religious belief, to meet and come together in a safe space. Salford, why are we applying? Well, deaf people don't get to access change and influence fairly. They're kind of bolted on, coming at the end. So people listening and engaging don't directly use the voice to influence or ensure services are fit for purpose. They actually are just using a best guess. This is what we think should be done. Because of that, that shows usually this is our best guess. That comes from a place where there is a chronic lack of deaf awareness training throughout the city. People are not aware of the cultural needs or the two differences between deaf and how they don't necessarily mix, but their needs and what they use to access services are completely different. A response or decision when it's challenged comes from a position of tokenism, or we're coming to help you because we've been challenged, or services are being reactive rather than looking at what is truly needed or what is wanted. And in some cases, people forget about the legal statutory responsibility placed upon adult social care or primary care services because they've stopped looking at what fundamentally is required. And that basic needs for access are replaced with other things. So thinking about that model, the deaf people are regularly asked to carry cards to prove that they're deaf and then ask what the mitigation is then to provide that access. But that's going back to that earlier model of let's give you something extra or putting something extra on you, the deaf person, to then assert their access needs when actually, because of a lack of deaf awareness and training throughout our city and Greater Manchester, regionally and nationally, that's been really key. The Mental Wellbeing and Disability Report of 2021 was a really key document, and the findings and recommendations are something that we followed quite closely with me as Deaf Community Officer. So we've definitely looked at the issues at the disproportionate effect of deaf people, where they've been excluded, where they've been isolated, they've not been able to genuinely find an easy way to access information. It's not in one simple place. So it also says in the report people access sport and other wellbeing activities in a different way. And still in Salford we have a major issue. So deaf people can't go to an arts and craft event unless we create something specific. They can't go to an exercise, swimming or walking group that exists because generally they're not accessible. They may not have the deaf awareness to deliver that and meet that need. Social connectors, our community connectors, can't do that. The social prescribing doesn't work for deaf people because there's no built-in element of trading for those people delivering social prescription to ensure that a deaf, small d deaf person gets their access needs, or that there's BSL provision, because invariably where people have bid for monies, that doesn't include anything related to accessibility. And the knowledge of using a loop system, even if it's charged, through to being able to use Bluetooth to link with equipment is just non-existent. So we're not even able to upskill our wider deaf community with that. Also within the recommendations, very much we've listened to deaf people and said, actually come along on a journey. If you want to make a difference, let's make some complaints. Let's get some responses. I think it's really key to look at the health access crisis that was released by BBCC here at the beginning of August. Really key video from down the road in Liverpool, where deaf people are not getting access to healthcare. They're not given that equitable, accessible way to be empowered to do it themselves. And that's really key. That's unfortunately an issue that relates to specification and commissioning. But people on the front line are not aware even how to book interpreters. Throughout council, primary care and secondary care, it's always put on the deaf person that they've got to assert their right to make sure accessibility is there for them. But it's also telling our deaf community that it is their right and they don't have to put up with substandard access. Very much the funding bid talks about one size doesn't fit all, and right at the beginning of this I've said that deaf with a small d and deaf with a big D deaf people, their access needs are completely different. But also where people say, oh, write things down or can you lip read, sometimes we have deaf people even in our city that can't use written English. The most BSL users don't use English in the same way as hearing people. or as people who are deafened and who've lost their hearing. So one size fits all is absolutely imperative in the work that we've done. So some key focuses that we want to use your funding for is to support deaf people in the city to carry on what they've been doing over the last 2.5 years, and also to start influencing the Greater Manchester Interpreting and Translation contract that is up for renewal on the 1st of April 2025. In Salford, we've had Sign Live, a service on your app, on your phone or smart device, where you can contact your GP, your pharmacy, your optician or your dentist directly in sign language, to book your appointment, to change your appointment, to get your blood results, to order prescriptions. It's not been there though to deal with clinical appointments. That's very important. But it's been able to allow people from their own home book appointments. They've not had to rely on anybody else, and they've not then had to go into the surgery sometimes when it's been quite dangerous to do so. We are the only local authority out of the 10 in Greater Manchester that have that service, and I'm really proud that our commissioners and service improvement managers took that step. But it's that threat from the end of March that it carries on, but also is rolled out and seen as a phenomenal model of good practice. It does happen across other parts of the UK, but we are the only local authority in the north of England that does so. So I hope that continues. So we want to make services innovative, we want to plan, we want to work together, we want to make them actually cost effective, bearing in mind there's 185 million missing or deficit in the Greater Manchester NHS budget. And again, one size does not fit all. I think also what's key is audiological services, social work services that work with the deaf community, and also deaf clubs around the city don't work together. There's very little communication, and I want to work collaboratively to bring everybody into the same space, to share good practice, to network, so that Manchester Social Services and Salford Social Services are able to share information and work truly collaboratively, and also include deaf people into that mix as well, maybe even include CPD training. So our first year of our project, very whistle-stop history, is we submitted 27 quite serious complaints to improve services. We've engaged with primary care partners to improve services. We've supported people during real emergencies at Salford Royal. We've signposted people to other services for BSL courses. We've worked with our own CVS, God bless you Salford CVS, and challenged them to improve services for our D-deaf community, and think about accessibility elements when they put out funding streams across the city. We've also engaged with Salford Council, primary care, secondary care. Secondary care is a real challenge. I'm also a public governor for the Northern Care Alliance, and that's a massive brick wall of a challenge. But we've sought to influence change and include better access that is built in and not bolted on later. Bolted on later and retrospective never quite works. Salford Council have genuinely got on board. They've done a 7-point plan to improve accessible communications and accessible services across the city. They're bringing in a video relay interpreting service so deaf people can contact the council in sign language. And also I've just talked about Sign Live that is strengthening services within primary care. Our second year, which was disability investment funding from Salford City Council, had me laughing, crying, listening, shared information. It got me quite frustrated, angry and cheeky. I dared commissioners to do better, and I dared other officers to do better, which is working. I'm proud of actually what those officers, with our deaf people working together, has achieved. And we've provided regular appointments and support for deaf people to save money, to be able to send letters, to give that communication when there's been no access. And that's been really important, and I'm very humbled that there is a lot of respect from my wider deaf community into the work that they've really fed into me to deliver. But we've also supported where those organisations have not been forthcoming, to challenge them appropriately and seek financial recompense. And last year we got £1,200 for deaf people who've been mistreated just for being deaf. We've done campaigns within our deaf community and to professionals across the city under the Your Rights campaign to really ensure that access to healthcare is looking at the Accessible Information Standard. I've already talked about See Here's health access crisis, and the 5-point plan under the Accessible Information Standard has gone to professionals and to deaf people to explain what their rights are. But deaf people want equal access to health and counsel services in the same way as their hearing peers, and that they're given a fair service. That means they can access services independently without barriers. They don't have to rely on somebody else. They don't have to turn up to a service when other people don't have to. We also worked with Merseyside Society for Deaf People, looking at their video that they created, encouraging the deaf community not to sit through appointments and nod their way through, but actually challenge that, empowering and really asserting that the deaf community can go into an appointment without the right level of access and say, stop, we cannot continue this appointment because the equipment's not working, because there's no interpreter, and also appropriately challenge that and put that in as a complaint, because our deaf community have found that by reporting things, nothing's happened and they don't get any response back. But by making a formal complaint, things have happened and things have changed. Throughout all of this, our deaf community have been encouraged to help yourself, and that will help others. And I want to share this quote with you. Salford's magnificent deaf community have for 2 years and much more given their voluntary time and significant personal experiences to ensure services have improved in the city. And many deaf people during their complaints that have been videoed, and I'll happily share those with you where appropriate. A lot of the deaf people in meetings and those complaint videos have said, I don't want other deaf people to have the same experience I had. I don't want them to suffer the experience I had. So please, thank you for your time. Please have a look at our 2023 Deaf Community Report. Please look at our 2-year celebration from the 29th of April. And also please look at the BBC See Here programme that was released. I think it's Series 43, Episode 22, but I will send a link and ask the GMCVO staff to share that with you, about the keep saying mental well-being, but this is actually about mental well-being. It's the health access crisis, which is very recent, and the story of Richard Body and his daughter Kate, who is also an interpreter, and the poor service they've had in Liverpool. That happens in Salford. That happens in Salford in 2024. And it's time to stop that in Salford and across Greater Manchester. Thank you.